So the second hallmark is done, which is the tumor suppressors. The third one will be metabolic alterations. So the tumor cells are not going to follow the normal metabolism which a normal cell undergoes. Okay, so normally a normal cell is going to undergo oxidative phosphorylation in the mitochondria to produce ATP in the presence of oxygen. So as the name suggests, oxidative means there is going to be oxygen. So whenever oxygen is present, it is going to use up the substrates and undergo oxidative phosphorylation so that lots of ATP is produced for energy. So main function of oxidative phosphorylation is energy production. But the same cell in the absence of oxygen, it is going to undergo glycolysis, and this glycolysis is mainly for producing intermediates. So it can produce ATP but very less amounts. So compared to the oxidative phosphorylation, glycolysis can produce very less ATPs, and the main function of glycolysis is going to be production of intermediates. So this tumor cell is going to take up this glycolytic pathway even in the presence of oxygen. So that is the main important factor here. So even in the presence of oxygen, it is not going to undergo oxidative phosphorylation. Instead, it is going to undergo glycolysis. So this is called as the Warburg effect. So Warburg effect is nothing but aerobic glycolysis. That is, in the presence of oxygen, there is going to be glycolysis. So why? Because in order to produce intermediate. So the tumor cells are not going to need energy. Basically, it is going to need intermediates because it is proliferating continuously, right? So when it is proliferating, the cells need the intermediates for producing the components of the cell. So intermediates are needed to produce the cellular components of the tumor cells rather than energy production. So this is the main goal, and that is why glycolysis is being favored by the tumor cells even in the presence of oxygen instead of the oxidative phosphorylation. So this Warburg effect is the theme for PET scan. So usually in PET scan, if you see, PET scan is a whole body scan they take for cancer patients, right, to detect the metastasis and where else the tumor is present. So that kind of a thing we use in PET scan. So PET scan uses this phenomenon called as the glucose hunger of the tumor cells. So if you give fluorodeoxyglucose. So FDG is the one which we use in PET scan. So it is a fluorescent dye as well. So if you give this glucose, FDG glucose, it is going to be preferably taken by the rapidly dividing cells. So any rapidly dividing cells will actually undergo this Warburg effect rather than the oxidative phosphorylation. So in bone marrow cells also, which is rapidly dividing, and any kind of proliferative cells in the body, normal cells also, it is going to take up this FDG because it is going to undergo this Warburg effect. So it will take up this glucose and then undergo glycolysis. So these tumor cells are also rapidly proliferating. So FDG is going to be taken up by the rapidly proliferating tumor cells as well. So it is because it is fluorescent, it is going to be highlighted. So that is how we are going to detect the tumor metastasis with the help of PET scan. Under metabolism itself, there is going to be something called as oncometabolism. So tumor cells actually preferably mutate the gene enzymes which are involved in the Krebs cycle. So Krebs cycle is one of the pathways we read in biochemistry, right? So in the Krebs cycle, we have many enzymes. Out of that, some of the gene enzymes are going to be mutated by the tumor cells. So for one such example is the isocitrate dehydrogenase, so IDH. So it is an upcoming mutation usually actually. So isocitrate dehydrogenase is mutated. So normally isocitrate dehydrogenase is going to catalyze some other reaction, but in this oncometabolism, what will happen? This mutated IDH is going to convert the alpha ketoglutarate, which is the normal substrate, into an oncometabolite called as 2-hydroxyglutarate. So instead of forming some other product, is going to form the 2-hydroxyglutarate, which is the oncometabolite. So what is the use of this 2-hydroxyglutarate? This 2-hydroxyglutarate is going to inhibit the epigenetic regulatory enzymes. So we were already seeing about the epigenetics, right? So in the epigenetics, we discussed DNMT3A, MLL genes. So these are all involved in the regulation of the epigenetics. So those genes are going to be inhibited by this oncometabolite, and that is going to result in lots of epigenetic changes, and epigenetic changes, lots of silencing and mismatch is going to happen, which is going to result in the formation of the cancer. Okay, so in this you must remember IDH mutation is going to result in the formation of oncometabolite 2-hydroxyglutarate. So what all tumors have this IDH mutations? So they are going to be specific. IDH mutations are present in gliomas, cholangiocarcinomas, chondrosarcomas, and also in acute myeloid leukemia. So these are specific. IDH mutations are present in these cancers. Okay.